Welcome back. February is Heart Health Month, and we have a special guest in the studio. Dr. Paul Arciero is a professor of nutrition and health science. Welcome to the program.
Good morning. Thanks for having me.
Now I understand February is National Heart Health Month.
It is. So the American Heart Association has designated February, the entire month, as National Heart Healthy Month.
Okay, and it's the number one killer?
Number one killer, yes. Still, despite all of the strategies that we try to employ to prevent it, it's still at top of the list. So we're making great progress, great stride, technologically, medically, pharmacologically, but still we're lagging a little bit behind with the lifestyle.
Mm-hmm. Now, I understand there's some obvious symptoms for people, but then there's some symptoms like for maybe women that people may not know about. Can you just talk a little bit about some of the symptoms people can be looking for?
Sure. I think that's a really important topic, and people need to be aware of it because it's different for different people, and of course, as you just alluded to, it's different between men and women. So the most normal response that a person has when they're having a heart attack or some type of cardiovascular event, they have chest pain and discomfort, and it's usually centrally located, but it can begin to radiate up around the shoulder and down the left arm. So other people experience a form of indigestion, shortness of breath is usually a telltale sign, and just not feeling right. Something is wrong, and if you can pay attention to those signs and symptoms, you should get yourself to some immediate medical attention.
Okay, and what about for women?
Yeah, so for women it's sometimes not as specific. It's a little bit more diffuse, and so they might have the chest pain, they might have it radiating, but it might be a headache. It usually is accompanied by a shortness of breath, but it's not that typical centrally located radiating pain from the chest area. And so they need to be aware of that. If they're just not feeling right, they have this shortness of breath, maybe they're having a headache, they're just not feeling right.
And what are maybe some preventative measures? I know for some people having heart disease run in the family, they may be on the lookout for some symptoms, but they may also benefit from lifestyle changes?
Absolutely. So genetics is a primary risk factor. So if you have a genetic predisposition in your family, then that is something that you need to pay extra attention to. And that would require regular checkups at your healthcare provider. But then there are some really helpful lifestyle strategies, and there's really three that we should target. First is stress management. We need to reduce our stress level. So there's lots of different strategies that people can employ. Meditation is very effective. Yoga is very useful. But taking time each day to center yourself, to become more balanced in your overall well-being. Next would be making sure that you're staying active, so staying physically active. And it can be programmed, structured exercise, or it can be just being more physically active during the day, building in a walk, for example, to a destination, taking some flights of stairs within your work environment as opposed to jumping on an elevator or an escalator. So it's kind of building it into your daily routine that I like to have people do, because then it makes it a little bit more easy to accomplish. It doesn't mean that you have to get yourself all into a gym routine or pack your clothes and make it a more of a structured type thing. You can just build it into your daily routine. And then third, and perhaps the most effective, is nutrition, making sure that you're eating the right foods, because as I always tell people, nutrition trumps exercise all the time. And so despite all of the good intentions that we have, remaining very physically active and healthy, if you're not feeding yourself and nourishing yourself properly, well then that's going to catch up to you.
Right, right. What are maybe some healthy options for people nutrition-wise?
Great. So reducing salt intake, we know really influences and affects our cardiovascular risk by increasing our blood pressure. You know, there was the lipid hypothesis for a long time that all fats were bad, but we're finding now that certain fats are very healthy for us. There are some that are more problematic. Those that are in saturated animal fats can be sometimes more problematic. Hydrogenated and trans fats that are in a lot of baked goods. But other healthy fats are things like fish oil, and oil from nuts and oils from plants are very heart healthy. So those are very healthy foods. Maintaining a high fiber intake. So men should strive for 38 grams per day, women 25 grams per day. And having it in food is the best way. And then lots of fresh fruits and vegetables. Now I know it's a little bit harder up here in the Northeast when we're a little bit more limited to that type of healthy fresh produce, but there's farmers markets available for people. So keeping your healthy intake of carbohydrate through fruits and vegetables and fibrous grains and legumes is very helpful. And then eating lots of lean, healthy proteins, eggs and fish, and beans, legumes are really the strategies that people should employ.
Good, good. How much is age a factor for people?
You know, we used to think that disease was just a natural function of getting older. But we now know that when we age, we can prevent many of those age-related diseases that we used to just assume would be immutable, that they would just occur. And so the good news is that even as we begin to age, we can maintain a very, very healthy heart and cardiovascular system by following those three helpful lifestyle strategies. But eventually age does catch up to us, but we can prevent many of what we used to assume to be age-related diseases that we would just assume would happen regardless of what we would do from a lifestyle perspective. But we now know that through healthy lifestyle we can prevent many of those.
Is there somewhere somebody can go for more information? Is there a hot spot that you know of that you can let them know?
Well, a great hot spot would be the American Heart Association, would be a great starting point, particularly for cardiovascular disease. And then there are other wonderful resources, the American Diabetes Association, because there's such a close link between people who have diabetes, particularly type 2 diabetes, and their subsequent risk for cardiovascular disease. So we call it the metabolic syndrome. And heart disease and metabolic, in this case diabetes, are so closely aligned. And so those two would be good starting points, at least to garner some helpful information for people.
Right, right. Okay, is there anything else that we've forgotten that you'd like to add?
There really isn't. I think that, it's such a wonderful thing to have this put to the front stage for people, because it is such a really serious disease, and it affects so many millions of people that if we can bring it to the front and center to help people become more aware so that they can begin to enact healthy lifestyle strategies to prevent it for themselves and for their loved ones, then that would be a win-win for everyone.
We can almost change the future.
Absolutely.
All right, well, thank you very much for stopping by the studios today.
You're very welcome.
This great information. And to see this interview for a second time, you can go to our website, looktvonline.com.